Hello and welcome to my page. I am Marissa. I'm a first-year doctor, just about to finish my intern year, and then I will be starting dermatology residency at the University of Washington this coming July. I have made it through 11 and a half months of intern year by the skin of my teeth. I have less than 2 weeks left in this academic year, and so I figured this is as good of a time as any to do a little bit of a recap of the year and then share some of my tips for new interns who will be starting residency within the next few weeks. So let's get into it. Now, I have to be truthful and say that this year was actually pretty tough for me mentally and emotionally. As a medical student, I had rotated through the program that I eventually matched at for my intern year. So I thought that I knew what to expect in terms of what it would be like to be an intern at this hospital. Well, that turned out to be pretty naive thinking. Being a resident is such a different level of responsibility, and that it was actually kind of surprising to me. There's also so much less flexibility as a resident compared to when I was in medical school, especially with things like, specific days off for important events or sick days. Logically, I should have been expecting it because that's just part of what residency is, but actually having to have that experience was something that I found a little bit hard to adjust to. And I definitely struggled with missing holidays with my family this year. I worked 4th of July, I worked Christmas, New Year's, that was definitely an adjustment to spending so much time in the hospital. Just in general, spending so much time away from my son. I would see him pretty much 2 hours a day, and that was pretty much it. The upside of this year is that it definitely solidified for me that I chose right when selecting dermatology, and the inpatient life is really just not for me. There were certainly a lot of positive encounters and a lot of times that we were able to make a really meaningful difference in the lives of our patients, but for a long-term career perspective, it's not something that speaks to me. And so I'm glad that I kind of had this experience to kind of confirm to me that dermatology is really the right specialty for me. I'm really excited to be moving on to the next step in just a few weeks from now. While I would not say that I thrived emotionally this year, I did get a lot of positive feedback from the attendings that I worked with, from the senior residents that I worked with about my performance on wards, my performance in ICU, emergency medicine. So let's get into some tips to help new interns make the year hopefully go as smoothly as possible. Tip number 1, know that at many points during the year, you're going to feel dumb, but that doesn't mean that you are dumb. It doesn't mean that you don't know medicine. It doesn't mean that you aren't smart and have worked really hard to get here. You're kind of thrown right in and you have to all of a sudden from day one be the primary point of contact. And so be patient with yourself, especially during the first month of residency. Remember that there's a lot that you do know. You're going to learn and grow so much over the year. If you don't know every single thing from the start, it makes sense because that's what you're there to do. You're there to learn and put together all the building blocks of becoming a doctor. Tip number 2, find the resources that you like to use early for things like medication dosing and picking up topics as a medical reference guide. Even before intern year, you can be asking upper level residents, you can be asking friends from different programs what resources work for them, and spend some time early on familiarizing yourself with those resources so that you can get the information that you need in a quick fashion. You know how to use the app. Tip number 3, find your workflow and stick to it. If you didn't leave medical school with a solid approach to pre-rounding, the first 1 to 2 weeks of residency are really the time to drill down and figure that out. Talk to upper level residents about their workflows, ask fellow interns who kind of seem to have their shit together. Do whatever you need to do to start working towards getting this down really, really early. I've linked to the comments a quick guide to pre-rounding that I put together for interns that just walks through the process that I use for pre-rounding. You can take a look at that, see if it works for you. If it doesn't, that's totally fine. Just figure out how you like to approach your day early on and try to optimize that as much as possible. Tip number 4, optimize your EHR layout and smart phrases, and do that early. From day 1, you should have an interface that looks the way that you want it to look, with the tabs in the order that you want them to be in a logical flow. Most used tabs are in a prominent position and the lesser used tabs are maybe hidden or off to the side. Talk to senior residents, ask them to help you during orientation or if there's downtime during your first week or so of residency. Make sure that your EHR works for you, that you know how to use it, and that you know what you're supposed to be doing when you open up the computer. So spend some time getting comfortable with the EHR, moving things around, customizing things, stealing smart phrases, stealing note templates, whatever you can do to be as comfortable and efficient in the EHR as possible is just going to save you time. It's going to make your life so much easier because really the EMR is kind of the center of everything. Tip number 5, write down everything that is discussed on rounds and needs to happen during the day. If something doesn't get written down, even if it seems like the most obvious thing in the world, you run the risk of forgetting it. And you don't want to forget to order someone's insulin, order someone's Lasix. You need to make sure that everything that you discuss on rounds gets written down either electronically or on paper so that you can follow up with it during the day. Personally, at my institution, we prefer to write things down electronically. We use the Epic handoff function, which allows the entire team to kind of look at the list of tasks throughout the day and see what has been accomplished and what hasn't been. But if that's not how things happen at your hospital, then that's totally fine. Just make sure that you're making note of the things that you need to do during the day and the things that you already did during the day to make sure things don't slip through the cracks. Write things down. Don't let anything slip through the cracks. Well, those are some of my tips for how to make your intern year as smooth as possible. You know, I don't think intern year is ever smooth. Probably not. It's probably never smooth for anybody. If you like this video, make sure to like, comment, and subscribe, and stay tuned for more tips about life in medicine. I just need to be loose. YouTube is harder than Instagram because on Instagram I'm not really talking at anybody, but on YouTube I'm talking at you. Anyways, okay, we'll try again.